Good morning and welcome to the Shrewsbury Board of Health meeting. Today is April 26th. I'd like to call the meeting to order. First up on the agenda is to review and act on the Town of Shrewsbury Water and Sewer Department's request to seek relief from 248 CMR 10.10 in parentheses 19 with the Board of State Examiners of Plumbers and Gas Fitters for the bathroom requirements at the Rolfe Avenue Sewer Pump Station.
Great, thank you.
Welcome.
Thank you. Good morning, Dan Raleigh, Water and Sewer Superintendent, Dave Lyons.
Plumbing and Mechanical Inspector for the Town of Shrewsbury.
So we are in the process of finalizing design for about a $10 million sewer station and force main upgrade project, which will include our Rolfe Ave pump station, our Maple Ave pump station, and the force main from essentially Route 9 all the way up to Hutchins. That will all get replaced. We've been granted state revolving fund money for this. It's low interest borrowing for the project. So as we work through the final details of the project, we're realizing that the State Plumbing Board has really reaffirmed a requirement in the recent code update that a bathroom is required in unoccupied facilities. So the Maple Ave pump station is it's a bit bigger of a building. It already has a bathroom. So we believe we meet the requirement there, but the Rolfe Ave station does not have a bathroom. And we've looked at this many ways. And on the call is Tim DeGuglielmo from Weston and Sampson, who was going to provide a lot of details on the size of the building and you know the many approaches that they've taken to determine if there is space. And essentially what we've really discovered through all of the different options that we've explored is there's really not a way to add a bathroom without impacting the operation. So we're looking into going to the State Plumbing Board for a variance. We understand that they're not likely to give a variance very easily. So we certainly think we will try to make our case, but one of the first steps is to get local support from Plumbing Inspector and the Board of Health. So that's what we're here today, just to make you aware of our project and just kind of go through the details so you understand, and again, hopefully get local support. So I will let, if it's okay, Tim can maybe give a bit of a presentation on what his work has included.
Yep, and hopefully I can share my screen. Let's see. Give me a second. Let me know if you guys can see this, or when it loads up, I guess. So I'm just not talking to air.
Yeah, no, we can see, Tim.
Okay, so this is the site plan. I also have an architectural sheet that I can show too, but I just kind of wanted to give the overview of the site because we're kind of restricted. Obviously, there's houses on either side. The property lines are very tight. This is the actual, let me try to highlight this. This is the actual building that we're working with right here. This to the left here is actually the wet well. So this is all, there's a slab on grade. We have a bunch of HV equipment on top, some carbon odor control unit up there as well that is going to be put in. And then below grade is obviously where the sewage goes and the pumps pull from that, which are this is a 3-story building, the first floor and then 2 lower levels, and the bottom level has the pumps. And then on the right side here is a chemical tank that's probably 8 or 10 feet wide by probably the same height. I have some pictures too I can show after I go through this, so we can you can kind of see the size of that too. So. And then on the back side is the electrical. This is actually a fenced-in area here, and then all these are transformers to power for the power coming in for the station. So the building size we're kind of restricted, going in a lot of the directions here to kind of make it bigger to add square footage. And then I can pull up the architectural plans here, and you can kind of see. So this is the top floor. Oop. And again, this is all electrical equipment on this side, and kind of the other side to power, the pumps. There's they're going to be 125, 150 horsepower pumps by the time we get done with it. These grates here that are shown are actually go through all the floors, and that's how they pull the pumps up to the top level. And then there's a spiral staircase access in the corner here that goes down to each floor. So then the intermediate floor is all piping again here, and then the final lower floor is where the pumps, and they have a workbench in the corner here. So we're a little stuck trying to fit something that would fit a bathroom in there that would also not prohibit them from, kind of maintaining and operating the station. If you give me a second, I think I have some pictures here that may be a little more helpful too. And if you guys have any questions, please just jump in. I know I've been working on this stuff a long time, so it's some stuff I forget that it's a little easy. So you can kind of see the size of the chemical tank here that I was talking about. This is the wet well over here where the HV equipment's going to be on top, and then this is the entrance, the front entrance to the building. This is the top floor. It's a panoramic, so obviously, that gives you a good idea of the spiral staircase. There is a small shop sink here, and then the grating to pull the pumps with all the electrical equipment kind of either side here. And then I can show the intermediate floor, this is the one with kind of all the piping in the flow meter and all the discharge piping, pressurized piping for the force main itself on that floor. And then this is the lower floor here. Oh, it wants to load up. Oh, maybe we're not going to get the lower floor. Oh, there we go. Yeah, so that's their workbench that I was talking about before. There's a channel drain around the outside because obviously when they have to repair and maintain the pumps, obviously some water will get on the floor, and then it goes to a sump kind of in this far corner, back behind the third pump. So, I mean, to fit a bathroom in here, obviously it's it's got to be at least some size, whatever, 5 feet maybe by, 5 by 5. It kind of restricts what these guys will be able to do when you need to maintain the pumps. The station was built in the 60s, so obviously it didn't really intend to have a bathroom, I don't think, ever. So the space is, everything's kind of crammed into to what we have for the existing building. So that's why we're obviously going for the variance.
So is the building staffed full-time, or is it people popping in periodically to check on things?
So yeah, it's unoccupied most of the time. They probably, on a daily basis, they'll go in and check it, which is probably like a 10-minute, 15-minute. They kind of just go make sure everything's running correctly. And then if obviously something's wrong, they'll, if it's a problem they can fix, and Dan, you can correct me on this, but if it's a problem they can fix rather quickly, they'll do it themselves. If not, they may call, somebody in to kind of take the pump and repair it, or whatever his equipment needs to be done.
Yeah, that's correct.
And is that a porta potty to the left, the photograph? Or
This yellow,
Yes.
This is actually the chemical tank.
Oh, okay. All right.
Yeah.
It was the
So
shape.
I want to say it's like 8 feet by, that's probably another 8 or 10 feet,
Mm-hmm.
high. Tank, so it's for odor control. It's I believe it's like calcium nitrate or something like that drips in there. So it's a chemical dioxide is the proprietary name. So
Tim, you don't have a photo of how close the houses are, do you? Because we actually did talk about one of the options of putting a porta potty there, but the houses are really like right next door. So we felt that really probably wasn't the best option.
Mm-hmm. Any other questions from board members?
let me try to do an aerial photo here. Let's Google. Maple's a little more spread out, and obviously there's bathroom in Maple, so the way this station was built in the 60s. It used to pump all the way to Hutchins Street, which Dan was talking about, which is the discharge point. In the probably like 95, there's a project that added Maple Ave kind of in the halfway point. So now Rolf Ave pumps to Maple, and Maple takes in a small other gravity sewer area, and then Maple pumps the rest of the way. So the Maple Ave station is probably like 3,000 feet, maybe 3,500 feet away from this station. So they do, I mean, if a bathroom was really an issue, they could, go to that station if they needed to, and just pull up Rolf.
Yeah, and I looked on Google Maps, and it's 2 minutes to go from this station to the
Right,
Maple Ave
yeah.
station where we have a bathroom.
Yeah, so So this blue line is actually the force main. So you can see roll fab is here just to kind of, show, and then Maple Ave kind of got added halfway, and then the blue line goes all the way up to Hudson Street and discharges on that end. So, but yeah.
So why is there a state requirement for a bathroom?
Inoccupied excuse me.
Yeah, per the revised plumbing code on it, I think it's unoccupied that may require temporary maintenance of pumps and equipment. Now requires a bathroom, or I guess the clarification is that they require a bathroom now. So yeah, you can kind of see this is the building here with the houses on either side. That's the chemical tank, and then this is the wet well area along with the electrical equipment here.
Tim,
And this is a shed. This is the shed in the back. That's a generator. That's
we still have the
sized
picture,
for the
Tim. We have the picture of just the station with the door open up on the screen.
Oh, sorry, I was sharing the screen, and yep. So I'm talking to myself.
And maybe Dave could weigh in on the plumbing requirement too, just from his experience.
Seeing that this building is from the 60s, from the building department standpoint and plumbing inspector, I will be inclined to support the variance. So I'll put a letter together because I see the footprint and I've talked to Tim and I see where the building's located. And seeing that this is just a stop by point and check once a day, I would imagine when you would do big maintenance, you would provide a porta potty.
Yeah, we
At
need
that
to.
point, I would support this variance to go through. With the state plumbing board, it's totally up to them, but seeing this as an existing structure, I would see no problem.
Playing devil's advocate, what would be their argument to not give the,
They could
Period.
take a stance where they would want the bathroom, because it's clearly written that it's required. But because there's an existing building and it's being retrofitted, they may allow it, because the building cannot, on the footprint, expand out or up.
Right.
And you're 2 minutes away. Would have to write this variance to the state plumbing board explaining each step.
so Carrie, at this point, is it something that we take a vote on?
Yes.
Okay. Do I have a motion to give relief to 248 CMR for this project?
I'll move it.
You have a second?
Great. Dr. Abraham?
Aye.
Karen?
Aye.
Myself, aye. Great, the variance.
All right, thank you.
Thank you.
Thank you.
Thank you. I appreciate it.
Thank you.
All right, thank you.
All right, next up on the agenda is to review and approve the minutes from the March 20th Board of Health meeting.
I'll move.
Second.
Great. Dr. Abraham?
Aye.
Karen?
Aye.
Myself, aye. Next up is to review and discuss coronavirus COVID-19 updates.
Yes, to the chair, to the committee, this is Solo Dennis, Director of the Central Mass Public Health Alliance. I will ask my colleague, Ms. Emily Halton, to give an update.
Thank you.
Thank you. Okay, so let's see. We'll start with COVID. So our COVID cases, reportable COVID cases, have gone down between January to March. But again, they're reportable, so these are not the positive cases that get tested in the home, because those don't get reported. With flu has also gone down between January to March of this year. And there was one very small outbreak in a nursing facility in the month of March that was easily contained. Also, in terms of COVID, there is a new monoclonal antibody out. It was just reported, Pemgarda, that is available for people with moderate to severe immune-compromised conditions, and they can receive that along with COVID vaccines. It's a one-time infusion unless you really need to continue the treatment, then they can give it to you every 3 months. And it's free if you have Medicare Part B or private insurance. Moving to ticks, mosquitoes. So let's start with the mosquito. Mosquito update is important because in the month of May, we will receive an update from the Central Mass Mosquito Control Project. As we know, they will start to surveil for the Culex species mosquito that carries the West Nile virus. They will begin trapping them, collecting them, testing them, separating them by species, and informing us through monthly reports and weekly reports where the areas are that need to be treated. And they will treat as needed. The spraying program begins in June. They also have an abandoned pools program where whoever owns an abandoned pool on whichever lot, there is one treatment per year allowed at no cost to the city, town, or resident, and it's through a contact form. And Carrie, I can give you the link. It's a link to get the form. Also, with mosquitoes, they will be sending out the calendar for spraying sometime in May. So basically, we'll have a more detailed update in the month of May with what's going on. But the arborvirus reporting that I send out weekly, that starts in June, and I'll give you more on that in May and June. And that's really it, other than there is also an alert coming out about avian flu, and they've started testing milk samples for the positive virus for that, and more on that to come later. And we have had no measles cases that were reported, and this is mentioned because of the recent health advisory to alert us to global and domestic increase in measles cases.
You answered one of my questions.
So, and providers and schools are aware that students and children, especially children who are traveling, would need their MMR, and even sooner than 12 months if they are doing international travel. Otherwise, 12 to 15 months, you would get the first MMR. I think that's it from this end, from communicable diseases standpoint.
I have a question. Locally, do we know who's offering the new monoclonal treatment if somebody needs it? Or can they go to get that, because it's IV infusion?
It's IV infusion. I don't know at this point. I'll do more research. It may be hospitals. Maybe, I don't know, if Dr. Abraham, you've heard anything?
So neither hospitals yet. The infusion is designed for highly immunocompromised who, in spite of the vaccine, may still not mount enough of it. It's a prophylactic. It's to prevent acquisition of disease. So at this point in time, with the prevalence being so low, nobody would really be given, because it has to be given every 3 months in order to maintain immunity levels. And so that's why no institution has started yet.
Okay.
I presume probably in higher prevalence times of the year, there might be interest in, we have an infusion center, Mass has one too, so we'd probably do something, but right now the prevalence being so low, but it's not intended for treatment, it's only intended for
So it's
prophylaxis.
similar to like Evusheld? When we had Evusheld, it'd be like.
Exactly.
higher. Okay.
Yes, it's just, this one was designed specifically against the JN.1, which is the current variant in play, and has high efficacy against it. Well, Evusheld and most others didn't, which is why they've been withdrawn from the market.
Okay, great.
Yeah, so, yeah, I mean, it's nice, it's pretty brand new, but it's a nice addition to the vaccine if you're severely immune compromised. So, okay, I think that's it for this update.
Madam Chair, I was just going to make a suggestion that we revise this agenda item to be just a communicable disease update, since COVID-19 is only one small factor in the process now, and probably
I would
less
agree
so.
with that.
Yeah, I agree.
We were just talking about that before the
To change
meeting.
that.
Yeah.
Great, all right. Thank you very much. Next up is to review and discuss updates from the Central Mass Regional Public Health Alliance.
To the chair, to the council, just one update from our end. We are in the process of conducting second round interview for the shared service coordinator position. This position play a vital role in terms of coordinating all the alliance work. In the next month or two, we'll have someone in this position moving forward. If there's no question, I will ask my colleague Emma to give an update on the regional inspectional work in the town of Shrewsbury.
Thank you.
Thank you. So since last meeting, we've done 69 inspections. We haven't had many food complaints from our restaurants, which is great. There was one complaint that was unfounded. At the time of inspection, it was regarding proper glove use with employees and ready-to-eat foods. When I inspected, all employees were wearing gloves and changing at proper times. So I did provide a little bit more education for staff and the person in charge, but they were well aware of the standards. And previously, we did do I did do a follow-up at Buffalo Wild Wings shortly after last month's meeting, and they are still diligently working to address any issues that might come up. But they did correct all violations that were found at their routine inspection.
Excellent. Follow-up to the property on Arnold Street, Arnold Road, that I think was on here last month. What is the status of that property at this point?
Arnold Road still remains condemned and vacant and secure. The owners did get a court-appointed legal guardian to assist with the next steps on what they are deciding to do with the property, whether that be coming up with funding to make repairs to get them back in. I'm not too sure. I did walk the property again with the legal guardian, so they're aware of the situation and what is involved in getting this home reoccupied.
Okay. Thank you. Any questions?
No questions.
Thank you.
Thank you.
All right, next up is to review the meeting schedule. I believe the next meeting is
24th,
May 24th.
At 8
8
a.m.
a.m.
Here,
Okay.
yes. Meeting invite was sent yesterday. Thank you.
Great.
Thank you. All right, if there's no other items?
Just one, this Wednesday was National Administrative Professionals Day, so on behalf of the board, I'd like to thank Kerry for all that she does for us for the
Ah.
Board of Health. So
Thank you
Thank
very
you.
much.
Thank you,
My
Carrie.
pleasure. Thank you.
Should we clap?
Yeah.
Sorry.
All right, do we have a motion to adjourn?
So moved.
Second.
Great. Dr. Abraham?
Aye.
Karen?
Hi.
Myself, aye. Meeting is adjourned.
Thank
Thank
you.
you.
Thank you.